The most common symptoms across the area are being blamed on flu, strep throat, and allergies. Dr. Balaguru Ravi from Clear Lake says you do want to get checked out so you can know how to treat.
We can give antiviral prescription medications for COVID now and Tamiflu for the flu. For example, if it's strep throat, we can give you an antibiotic for that.
In Pearland, Dr. Stephanie Campbell says more adults are getting strep throat than normal. In Tanglewood, Dr. Sheena says kids are getting hand, foot, and mouth disease, conjunctivitis, and flu. Humble Dr. Caroline Carlson says she's noticing kids with pneumonia and wheezing in patients without a history of wheezing. Sienna Dr. Landry luckily says flu and RSV are on the decline there, while the Fort Bend Clinic is still seeing lots of COVID and common colds. According to the Texas Medical Center, the COVID positivity rate is up to 7.3% from 7.0 the week before. And Dr. Ravi thinks some patients who have COVID might not know it.
What I've been seeing is a lot of negative home COVID tests have a high false negative rate if you swab or if you check yourself within the first 24 to 48 hours of having symptoms. So it may be that it just didn't pick up enough of the virus to actually give you a positive test. So what I tell people is try to do the home COVID test at least 72 hours after you have symptoms to really know for sure, or at least increase the sensitivity of it.
For most of these viruses and sinusitis, the safest, gentlest, most natural way to relieve congestion is with a nasal rinse. I have never met a doctor who didn't like these. You just want to make sure that you properly clean it and dry it after each use so that you're not introducing new bacteria into your nose the next time you use it. I'm health reporter Haley Hernandez, KPRC 2 News.